Hi, this is Shanra. Thank you so much for tuning in, and make sure to subscribe if you want to hear more valuable information on beauty, health, and wellness. You can also follow my blog at shanraweisaesthetics.com or follow me on Instagram. So today I'm really excited to talk to you about microneedling. Microneedling, medical microneedling that is, as opposed to home microneedling, is a wonderful treatment to help improve fine lines, acne scars, and just give an overall glow and resilience to your skin. It should be in the arsenal of anyone's anti-aging regimen. Microneedling applies fine needles into the tissue and stimulates new healthy tissue growth. In medical microneedling, we often use platelet-rich plasma or PRP to supercharge your results. What is PRP? PRP is all of the factors in your blood in a concentrated form that are involved in collagen synthesis and tissue remodeling. So the miraculous little platelet, when activated, actually has growth factors, cytokines, chemokines, all these exciting things that make new tissue. So how are they activated? Well, they're activated with trauma, and that's where microneedling comes in. So tiny little needles form trauma to the skin, and then the platelets, they run to the rescue and form new tissue. And what's left in its wake is smaller pores, improved lines, improved acne scars, glow, tissue health, and it just kind of sounds like a magic wand. Well, it kind of is. So all this talk of tissue trauma sounds pretty scary, right? Actually, microneedling is very well tolerated. Almost everyone who comes to see me tells me after the fact, that was way easier than I expected. So what do you expect when you come to the office? Well, you'll arrive with clean skin, and we will further clean it with a medical grade antimicrobial and apply a topical anesthetic cream for about 30 minutes. While you're numbing, a small needle will puncture the skin and obtain 1 vial of blood in a special collective tube that can separate your platelet-rich plasma from the rest of your blood products. That vial's put in a centrifuge and it's spun down to create this golden, we call it liquid gold in our office, that will be used on your skin. So when it's ready to go, we go ahead and remove the topical numbing cream and apply a little bit of that platelet-rich plasma to your tissue and needle it down into your skin. So the needle depth can be adjusted from deep to shallow depending on what we're treating. For example, acne scars will go much deeper, and when we're on forehead or other bony areas such as your nose, obviously it will be a much shallower depth. So once we go through the whole tissue, and we really do cover the entire face all the way up to the eyelash, getting some of that crepiness under the eye, I'll massage a large amount of PRP onto the skin where it will remain for a few hours. So after the numbing cream wears off, you're going to feel a little bit red and tight, almost like you fell asleep on the beach and you got a bad sunburn. And you'll remain red for 1 to 2 days. A few small proportion of people will remain red for a few days longer, and even a smaller proportion may have some swelling. For the most part, the downtime is very minimal, which makes this a beloved treatment in our office. So it's important to understand that microneedling is stimulatory in nature, which means that you need multiple procedures to get an optimal result. We usually recommend 3 to 4 treatments, and you can come back in a year or once a year to get a little bit of a boost, have 1 treatment along the way. Microneedling is also safe for all skin types, even darker skin tones. There are a few cases that it's not appropriate. So if you're pregnant or lactating, it's not unsafe to have microneedling, but we won't apply numbing cream, so you probably want to wait until after, baby is born. Also, if you've used Accutane in the last 12 months, we're going to have you wait until 12 months has gone by. And then any other skin infection, including cold sores, we're going to want to wait until that has cleared up, as well as any cystic acne that's active at the time. So after the procedure, it will be important to take really good care of your skin. You're going to want to stay out of the sun and have maximal sun protection with a very good quality sunscreen. Also, you'll want to abstain from your Retin-A or retinols for about a week, as your skin will be a little bit more sensitive. You'll want to use a very gentle cleanser and a good moisturizer. It's very common to expect some rough patches or flaking on day 3 or 4, and this just represents that the top layer of your skin cell turnover has been stimulated by this new tissue. So that's normal and expected. Usually that will clear up in about a week. It's also very important to understand the distinction between medical grade microneedling and at-home microneedling. At-home microneedling uses a derma roller, which actually can pick up tissue and tear it along the way. You can't adjust the needle depth according to what type of tissue or what you're trying to achieve. Also, sterility is really a problem. There's no way to properly clean an at-home microneedling system. A medical grade microneedling system uses a one-time use sterile cartridge for each treatment and therefore reduces any chances of infection. And most importantly, medical grade microneedling is able to use PRP, which is a way to supercharge your treatment, and why would you do it without that? So if you have any questions or comments, please leave them below. I'd love to hear if you want to hear anything else about microneedling or what it can do for you. Thank you so much for tuning into my channel. Make sure to subscribe, and you can follow along with my blog at ShaunnaWeissAesthetics.com or follow me on Instagram. I really appreciate your time and tuning in. Take care.